So hi everyone, my name is Xin and I'm a special care dentist at the Royal London Hospital. We see patients with additional needs and patients with dental anxiety on a daily basis, both for routine and emergency dental care. So some of these patients include patients with Prader-Willi syndrome. There is an increased risk of dental decay because of the food-seeking behavior, what we call hyperphagia, and also because they have dry mouth and viscous saliva. So that means they have reduced buffering capacity from the saliva and less protection from saliva. So when they have something to eat, the saliva takes longer to neutralize the acid in the mouth, and that could lead to a higher incidence of decay in the mouth. The other thing would be gum inflammation or gum disease. There is a link between diabetes and gum disease, and a poorly controlled diabetes would tend to have worse gum health, and likewise gum disease, which is not treated, could cause poorly controlled blood glucose. So in that sense, oral health and general health has a close link, and it's important to look after oral health to maintain general health. Patients with PWS experience acid reflux from the tummy, and that put them at an increased risk of erosion. So that causes tooth wear, eroding away the surface of the teeth, causing the teeth to be shorter and yellower over time. If that happens, it's important to see a dentist to monitor the progress of the tooth wear, and there is some measure that can be put in place to reduce the severity and the progression of tooth wear. We recommend twice daily brushing, and most importantly lasting at night, and no food afterwards. That way the fluoride from the toothpaste will be able to work their magic overnight, and that is also when saliva flow is the least in the mouth. So when there's less saliva in the mouth, there's less protection in the mouth. So we want the fluoride to stay on the teeth overnight. That's why it's important to spit and not rinse after brushing at night. Also, the timing of the brushing shouldn't be right after eating. There's a misconception that we have to clean our teeth after eating to get rid of the sugar in the mouth. But the mouth is actually very acidic after we eat, and if we brush at that time, we are actually dissolving the teeth further when it's the most acidic. If a patient does not have sensory issue, we recommend an electric toothbrush, so one with a small head, and it oscillates and rotates. Otherwise, a manual toothbrush with a small head and is soft is really good for removing plaque. So how you use it will be if you position it at the gum margin and brush gently, not more than 2 teeth at a time, and slowly make your way around the line of the arch. With an electric toothbrush, you position it on the gum margin and the tooth, and don't apply any extra pressure on it, otherwise it causes gum recession. There are some area in the mouth that is not reachable by toothbrush, so in that case we recommend using a floss. So a floss is really good for area of the mouth which is crowded, where you can't get a brush in there. So in each contact point there's 2 surfaces to clean. So if you could gently ease the floss into one surface and then bring it around one side and then bring it right out, and then move on to a fresh piece of floss and then bring it right into the same gap but onto the other side this time, before bringing it out again. That way both surfaces will be clean with the floss. If this is slightly tricky because of manual dexterity, there is a floss set that we could, with a handle, that would help to make it easier. So you could just again use it on both surfaces in the gap, and so there is an alternative. If you have larger gap in between the teeth, we have what we call bottle brushes or TP brushes. The one with the long handle and is at an angle is really good at the back. So You could see how it fit nicely in between the teeth, and that way if push any food that got stuck in between the contact point out. This small handle brush is good for at the front. Yeah, so that is option for cleaning in between your teeth. So this is called a single tufted toothbrush, and it's effective in cleaning behind the last standing tooth when you have a wisdom tooth coming through, because what happens is that tooth is at a lower level than the rest of the teeth, and it can be easily missed, whereas this toothbrush has an angle that let you get into the biting surface of that growing tooth. It's also good for tooth surfaces facing a space, so you could see that it could clean the area better because of the size of the blister. If you struggle to clean in between your teeth because a child is not happy to open their mouth long, there is an option of using a finger guard to keep their teeth apart. So you use it in one hand and you use the other hand and just clean around the rest of the mouth that way. Yeah, and we do also have plaque disclosing tablet that could show the area of the teeth that is missed. It stains the plaque bright purple pink. So any area that's not brushed well will stay purple pink, so it trains the child to improve their brushing technique, and it's good to make sure that no area is missed in the mouth when brushing. If a child has limited attention span and does not tolerate brushing for long, a three-headed toothbrush, also called a Dr. Barman brush, is very good at brushing multiple surfaces at once. So you could see how it fits around the tooth, and that way you just have to go around the arch once and all the surfaces will be brushed in one go. There is a lot of brands, flavors and strength of toothpaste in the market. So we recommend for children under the age of 3 years old to use fluoride toothpaste of 1,000 parts per million, but just using a smear, so a thin layer on 1/3 of the toothbrush, which is shown in the picture here. And for children above the age of 3, we recommend a pea size of adult strength toothpaste, so that is 1,350 to 1,500 parts per million toothpaste, part per million fluoride toothpaste. For people at increased risk of decay, the dentist could prescribe a high-strength fluoride toothpaste. So for patients above the age of 10, we could prescribe them with 2,800 parts per million fluoride toothpaste, and above the age of 16, we could go up to 5,000 parts per million toothpaste. With all this extra protection, it's even more important to not rinse the mouth out after brushing and keep the toothpaste on the teeth by just spitting out the excess and leave them overnight. Fissure sealant is a plastic coating that acts as a barrier on the biting surface of the teeth. It is effective to prevent decay if we could get it done in a dry environment. And the mouth is quite a wet environment, so unless a child or an adult will be able to keep their mouth open long enough for the procedure to be done successfully, it might not be recommended for patients with limited cooperation span. So if a fissure sealant is not done in a dry environment, it could leak and bacteria could get underneath the fissure sealant, leading to hidden decay underneath the fissure sealant. And if that is the case, fluoride can't get to the tooth surface as well because of the leaking fissure sealant, and you might actually end up with worse decay underneath the fissure sealant, and that might not be picked up until much later because of the presence of the barrier, and it's not easily noticeable by either the parents or the dentist. Tooth grinding is common not just in patients with additional needs but also in the neurotypical population. It might be more common in children, and some children outgrow them. However, it could also be a habit, or it could be because they are in pain or because they are under stress. As long as the underlying factor is ruled out and the extent of tooth wear caused by grinding is not too extreme. It's a matter of monitoring it. We also have to be mindful that some medication, such as antidepressant or antipsychotic, could cause the side effect of grinding. So there is also an option of talking to the doctor to see if an alternative is available. We recommend 6-monthly dental checkup, but if a patient is at an increased risk of dental decay, we recommend 3-monthly checkup. The reason being is we can get used to them seeing a dentist. Also, it allows us to pick up problems early, and we can also reinforce prevention to prevent dental diseases such as gum disease and dental decay. Things like decay could be picked up by having regular x-ray done as well. So if your patient is at increased risk of decay, we will carry out x-ray at a more regular interval. I always tend to use the shoelaces tying analogy. So if a child or an adult can tie their shoelaces well, it means that they have the manual dexterity to brush their teeth well. But I always try to empower the child or the adult to brush their teeth. So we teach them the right technique to do them. We use pictorial because they respond better to pictures and written instruction to brush their teeth. Versus verbal. So we use pictures and written instruction to teach them how to brush their teeth, and then we encourage them to do them by themselves while being supervised. And I always encourage the parents to go over the brushing to make sure that no area is missed. Some people might require support throughout their life, but it's important to give them some control so that they feel that they are in charge with their own toothbrushing. So there is option of using the incentive chart to motivate people to look forward to toothbrushing and also to incorporate that into their daily care plan. Things like music and video can also make toothbrushing more fun. So I encourage the parents to find a time that suits the person best. Sometimes it could be at bath time, sometimes it could be when they are watching a video. They could also use a tooth timer to make sure that the child is brushing their teeth for the correct length of time. I hope that you find the prevention advice useful, and I know there's a lot of things going on in Prader-Willi syndrome, and teeth might not be high up on the priority list. However, it's important to consider the mouth and the teeth as part of the bigger picture of general health. So by taking small steps in prevention and in raising awareness, that could go a long way in preventing future complications and health interventions. So I hope you enjoy the session. Thank you.